Why does this type of weight loss jab cause sulfur burps and diarrhea? Retatrutide may slow gastric emptying via GLP-1 pathways, which can increase fermentation of sulfur-containing foods and lead to sulfur burps. Diarrhea, on the other hand, may result from a combination of changes in gut motility, bile acid metabolism, and the gut microbiota, mechanisms that are still being studied. Are sulfur burps and diarrhea normal side effects of retatrutide? That's a question we're hearing more and more as this investigational medication moves through clinical trials. Let's break down what the current evidence actually tells us. First, an important bit of context. Retatrutide has not yet received marketing authorization from the MHRA or the EMA. Everything we know right now comes from phase 2 and ongoing phase 3 clinical trial data, so that framing matters throughout this video. So why does retatrutide cause these symptoms? It comes down to how the medication works. Retatrutide is a triple receptor agonist. It activates 3 receptors simultaneously: GLP-1, GIP, and glucagon. That multi-receptor activity sets it apart from earlier medications like semaglutide or tirzepatide, and it means the gut is responding to quite a significant set of signals at once. One of those signals, via GLP-1 receptor activation, slows down gastric emptying. Food stays in your stomach and upper intestine for longer than usual. When that happens, gut bacteria have more time to ferment sulfur-containing foods, such as eggs, red meat, and cruciferous vegetables. That fermentation can produce hydrogen sulfide gas, which causes that unpleasant rotten egg smell when you burp. It's worth noting this is a plausible mechanism based on what we understand about GLP-1 based therapies more broadly. Direct evidence specific to retatrutide is still limited. As for diarrhea, phase 2 trial data reported it in roughly 20 to 30% of participants at higher doses, with symptoms most pronounced during the dose escalation phase. The good news is that symptoms are generally described as mild to moderate, and for many people they become more manageable once a stable dose is reached. If you're currently in a retatrutide clinical trial and experiencing these symptoms, there are some practical things worth discussing with your trial team or doctor. Reducing your intake of high sulfur foods, such as eggs, red meat, and cruciferous vegetables like broccoli and cabbage, may help with sulfur burps. Eating smaller, more frequent meals can also ease the burden on a slower emptying stomach. And staying well hydrated is especially important if you're experiencing loose stools. Your trial team may also discuss the pace of your dose escalation. Slower titration can help your body adjust more gradually, but please don't start, stop, or adjust your dose or titration schedule without guidance from your trial team or clinician. Now, when should you seek medical advice promptly? If your diarrhea is bloody, severe, or persists beyond 48 to 72 hours, contact your doctor or trial team without delay. Seek help if you develop signs of dehydration, such as feeling very thirsty, dizzy, or producing very little urine. Persistent or severe abdominal pain that could suggest pancreatitis or gallbladder disease also warrants urgent attention. And if your burps are accompanied by fever, significant unintentional weight loss, or prolonged diarrhea, other causes, such as a gut infection or small intestinal bacterial overgrowth, should be properly investigated. If you're unable to reach your trial team and you're worried, contact NHS 111. For severe symptoms, such as severe abdominal pain with collapse or signs of serious dehydration, call 999. If you experience an adverse reaction within a clinical trial, report it to your trial team. You can also report suspected reactions directly to the MHRA via the yellow card scheme. To recap, sulfur burps and diarrhea are among the most commonly reported gastrointestinal side effects in retatrutide trials, linked to how the medication affects gastric emptying and gut motility. Symptoms are often self-limiting as your dose stabilizes, and dietary changes alongside clinician-guided titration may help. Always speak to your doctor or trial team about your individual experience. This video is for general information only and is not a substitute for personalized medical advice. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please do like this video and subscribe to the Bolt Pharmacy channel for more evidence-based health content.